Ronnie.
Hi.
My name is Bonnie. I'm your nurse today, and just wanted to check in and see how you're doing.
I'm doing pretty good.
Okay. Well, I'll tell you what, I'd like to look at your legs. I mean, you've had a lot of swelling from the heart failure diagnosis you have. So if you don't mind, can I look at your legs and kind of see how?
Sure.
Looks like you're still a little bit swollen, aren't you? Okay. Well, your doctor has you on a medication called BUMEX, and that's to help rid of some of the fluid. Do you know much about BUMEX? Have you? No?
I mean, I just kind of assume everything's for my heart failure since that's what I'm in here for.
Okay. Well, he would like for us to give you a 1 milligram dose of it every day and through your IV. And we'll do that, and it'll take like 1 to 2 minutes to push that through the IV. You shouldn't feel anything. You might feel some cold. It shouldn't be real uncomfortable. And then, tell you what, let me go ahead and do that. And can you tell me your name and your birth date?
Ronnie McDonald, 1497.
Okay. Grab some gloves here. Okay. So Ronnie, there's I know we talked a little bit about this thing they call them contraindications. Like, you know, you're not having, you don't, it sounds like, any allergies or hypersensitivities. You haven't had any hepatic comas going on, any electrolyte depletion. So all of those things are okay. So we're good to give this medication to you safely. Okay. Okay. We're gonna just go ahead. Hold this for 20 seconds. Flush it.
Do I have to watch what I eat or anything when I'm...
And actually, this medication doesn't really affect what you're eating, so you can have whatever you want.
All right.
The doctor is going to give you specific information about how much fluid you can be drinking or taking in.
Okay.
I think sometimes they do give some restrictions, so
Okay.
you will let us know that. So here's the BUMEX. And that'll go in over 2 minutes. It'll take
Okay.
2 minutes to get that in.
So I think I remember the last time I was given this, I was kind of feeling a little dizzy. Is that normal?
That can be normal. And this medication can cause a person to become dehydrated. And we'll kind of go over some of these things here. Talk a little bit about the food and the fluid intake, right?
Yeah.
So you're good on that. You can eat whatever you want. The doctor will give us some further orders on the fluids. Another thing that you'll not want to be taking are any NSAIDs, because they decrease the effects of this medication. We want to make sure we rid of that fluid for you so you start feeling better. Don't want to be drinking any alcohol either. I don't know what your habits are in that, but if you can avoid that for a while, that's going to help. Some other possible effects that a person might have is dehydration. So it's ridding you of fluid, and while that's happening, eventually if it's too much at one time, then you become dehydrated. That can cause you to have things like feeling sick, your blood pressure becomes lower, which means that you may get what they call orthostatic hypertension. So you'll want to be really careful when you go to sit edge of bed. Like, you're going to get up and run to the bathroom.
Yeah.
You want to walk for one thing, but you want to sit up edge of bed, sit there a minute, kind of get your bearings, because sometimes we feel lightheaded. Same thing when you go to stand. You want to stand up and just take a moment,
So
catch yourself.
That's why I'm dizzy?
Yes.
Okay.
Yeah, that's right.
Okay.
That's expected. So you just want to take your time. The other thing is that we want to be careful that you're not having any trouble with your hearing, because sometimes this drug affects your hearing. So if you have any of these symptoms, make sure you let us know.
Okay.
Maybe when you do need to get to the bathroom, if you'll use your call light and come in and just be there for you, just to get up and over to the bathroom.
Yeah. Okay.
And then, do you have any questions?
Not really. I think you educated me very well.
Okay, well, I'm going to leave this sheet with you. There is one other thing I've forgotten to share with you, and that's that sometimes, it's not very common, but people have some difficulty breathing. They might have hives or itching with this medication, or even a runny nose, just different allergic reactions.
Okay.
Sometimes even not passing much urine, which is exactly what we don't want to have, and we want to see you passing a lot of urine so that you're rid of this fluid. But we'll monitor you closely, and you make sure you let us know if you have any concerns through any of this.
Okay.
Okay?
All right.
And then I'm going to leave this with you.
Thank you.
Okay?
All right, thanks. Come in.
Hi, my name's Nicole, and I was just wanting to come back and reiterate some patient education with you. Can you confirm your name and date of birth for me?
Ronnie McDonald, 1497.
Excellent. I just spoke with your nurse, Bonnie, and she said that she gave you your BUMEX about 30 minutes ago, so I just wanted to come back and talk with you about the education that you had.
Okay.
Could you talk me through like the dosage and route that she used for that?
I mean, she gave me 1 milligram through my IV.
Awesome. And then do you know if there's any drug or food indications that you need to be aware of?
She said I could eat pretty much whatever I wanted. I don't have to change my diet, but I shouldn't be taking NSAIDs with it.
Yeah, excellent. And then also with that, just remember, consumption of alcohol is not really warranted as well.
Yeah.
And then how about any possible side effects or adverse effects that you need to report to us? What are some big ones that she kind of went over with you?
She talked about hearing. If I'm experiencing any hearing loss or like ringing in my ears, I could go call them. If I feel dizzy, that's probably because of the low blood pressure, and also stay hydrated because I could become dehydrated on the medication because I'll be peeing a lot.
Excellent. Sounds like you have a good coverage of the information. If there's anything else you need or whatnot, just please let us know. And then I know that Bonnie did give you this sheet, so just be aware of that. And then if you have any questions, you can look over that or contact us and we'll come back with you, okay?
Okay, thank you.
Absolutely.